Instructions. The listening test is 45 minutes. There are tasks in the two parts of the listening test. Each task consists of a recorded video or audio scenario. The number of questions for each task also varies depending on the length of the video or audio. There are multiple choice questions for some listening tasks and shift-to-shift report for others. After you have completed all the tasks in the listening section, you may have some time remaining. You can use this time to navigate back to previous tasks to check your answers. Now get ready for the test and follow the instructions. Part 1. Tasks 1 to 4 instructions. You will listen to a short audio or video recorded conversation and answer the questions. While listening, select the correct answer from the options provided for each question.
Part 1. Task 1, Health Assessment Report. You will watch a dialogue between a nurse and a patient in a video scenario. You will get 45 seconds to read the questions.
Listen to the recording and select your answers.
Hello, Mr. Bailey. Thanks for coming in. My name's Amelia. I'm the occupational health nurse here.
Hello, Amelia. I was told to come and talk to you about my health report.
That's right. Your health report showed up a few problems. Your cholesterol level is quite high and so is your blood pressure. Can you tell me what you know about high cholesterol?
Well, I don't know very much. I have to see the GP this afternoon about some tablets, but I don't know much about them either. I don't really know why getting my cholesterol down is important.
That's okay. I can explain it to you. Doctors become concerned if you have high cholesterol levels, as well as some other risk factors, if you are in a high-risk group for heart attack or stroke.
Oh, I see. Why everyone is worried now. How do I know if I am in a high-risk group?
Can you tell me about your family history? Is there anyone in your family with heart disease or anyone who has had a stroke?
Yes, my father had a heart attack and died when I was quite young.
Okay, family history of heart disease. Heart disease is one of the risk factors. Another is high blood pressure.
Oh dear. It's not looking good. Apparently I have high blood pressure as well. At least I am not a smoker.
Yes, that is a good thing. Smoking is another risk factor for heart attack and stroke.
So, what you're saying is that, if I have high blood pressure and high cholesterol, I am going to heart attack?
No. I'm not saying that. What it does mean is that you have more of a chance of having a heart attack or stroke than someone who doesn't have these risk factors. Can you tell me a bit about your diet and how much exercise you do?
Well, I have to be honest with you, my diet isn't what it should be. The wife is always at me to lose weight. The trouble is that I like a few beers when I come home from work. Once I sit on the sofa and turn on the TV, that's as far as any exercise goes. I only get off the sofa to eat dinner. My weight has just increased over the years.
I see. It is hard to get out of a habit like that. I understand how difficult it is to make changes.
Do I really have to make any changes? Most of my friends are as overweight as I am and they don't seem to have any problems.
I'm afraid it is very important that you make some changes. The problem in your case is that you have several risk factors. You have a family history of cardiovascular disease, you have high blood pressure and high cholesterol, and you are overweight and don't exercise enough.
What about these tablets? I think they are called statins. Won't they fix the problem?
They will lower the amount of cholesterol in your body, which is one important risk factor. You'll still have to manage the other risk factors. Are you willing to think about going on a weight loss program?
I am not really keen on the idea. I don't know, I have never been able to lose weight in the past.
I know it is a hard thing to do, but it is really important. It would be beneficial to do some exercise as well. Do you think that you could start walking a few times a week? Perhaps your wife might walk with you, or a friend could go with you.
Exercise doesn't have to be difficult. I will try to get the weight down. I will even go out for a walk. I don't want to have a heart attack like my father.
That's great. The GP will explain about the statins, which you must take every day. That's very important. I've got an information leaflet here on cholesterol and heart health. Take it home with you. If you have any questions, come in and see me again, or phone the number on the leaflet.
Thanks, Amelia. I will do that.
You will now have 45 seconds to review your answers.
Part 1. Task 2. Patient Care. You will watch a dialogue between a nurse and a patient in a video scenario. You will get 45 seconds to read the questions.
Listen to the recording and select your answers.
Hi, Mr. Scarlett. You're having your operation tomorrow. You're having a TURP, right?
Is that what it's called? It's my prostate. I've been having a lot of trouble with my waterworks.
You mean, when you pass urine?
Well, it's a lot of things. I have trouble getting started, you know?
Trouble starting to urinate.
Yes. I sort of start and stop. It's very frustrating. I feel like I have to pass urine a lot too.
I see. Your enlarged prostate is putting pressure on the neck of your bladder. After the operation, you should find this will improve, and you won't need to strain to pass urine.
Can you explain what will happen during the operation?
The operation is performed through a special tube called a resectoscope. It has a camera and a wire loop which is used to cut away parts of your prostate.
So there is no cutting involved?
Not with this type of prostatectomy.
That's good.
When you come back to the ward from your operation, you'll have a catheter in place. It will stay in place for a couple of days because your urethra will be swollen and it will be difficult to pass urine at first.
Okay.
We'll attach continuous irrigation to the catheter at first. The fluid helps to prevent clots from forming.
How long do I have that for?
It's usually for the first 2 days. Your urine will be slightly blood-stained for a few weeks, but that's nothing to be concerned about.
Okay.
It's also normal to have some difficulties passing urine for the first few weeks. It shouldn't be a problem after that, but if you do find you can't pass urine, make sure you tell your doctor straight away.
Is it dangerous?
It can be, if it happens suddenly, and you can't empty your bladder. Urine builds up in the bladder and causes a lot of abdominal pain.
All right.
I'll keep an eye out for that.
Is there anything else I have to do after the operation?
After your operation, you'll have to avoid lifting heavy objects and doing strenuous exercise for a few weeks. You may also need to take some time off work.
Yes, I've taken a month off. My work is very physical. I have to move a lot of boxes around. The doctor mentioned that I might need to take a break.
And that aware of is that you won't be able to drive for a few weeks until you fully recover and can drive a car safely.
That won't be a problem. My partner said she'll drive me.
That's good. Finally, Try to take it easy for a while. It's quite usual to feel tired for the first few weeks. There's nothing to worry about, as most men are back on their feet in a couple of months.
Okay, I'll try to relax, but I'm really not very good at it.
You have to take care of these things to recover completely.
Yes, nurse. Thank you for explaining all that.
You are welcome. Feel free.
You will now have 45 seconds to review your answers.
Part 1. Task 3. Manage aggressive behavior. You will watch a dialogue between a nurse and a patient's family member in a video scenario. You will get 45 seconds to read the questions.
Listen to the recording and select your answers.
Yes, Mr. Madison, you ran your buzzer. Can I help you?
No, it wasn't my father who called, it was me.
Oh, okay. How can I help you?
Well, you can help by telling me why my father is still in his bed when he should be having his operation right now. I'm sick of this. You people are useless. How difficult is it to take an old man to his operation on time?
I can see that you're very upset. Before we talk about it, I need to check with your father that it's okay with him for me to discuss this with you.
What do you mean? That just sounds like another delaying tactic to me.
Yes, I know it must seem like that, but it's important to make sure that your father gives permission first to discuss his treatment. I'm sure you can understand that he has the right to agree or not to having his treatment discussed.
Oh well, I suppose I understand. Dad, you don't mind if I talk to the nurse about your operation, do you?
No, I don't mind if you talk to Ileana about me.
Thanks, Mr. Madison. It would help if I understood a bit more about the problem. Can you tell me a bit more about why you're upset?
Well, thank goodness, finally someone is asking. I've been here with Al for hours, just sitting and waiting. He was supposed to go for his operation at 10 o'clock. He hadn't had a thing to eat or drink since yesterday. Someone just said he could not go, but didn't tell us why. Now we don't have any idea when or if he'll have his operation. If it goes on too much longer, I'm going to take him home. It can't be worse than being here. I'm sick of the way you get treated here. No one tells you anything.
I can see why you must be very frustrated by all this. If I've understood you correctly, you are frustrated about the delay in the operation, and feel that you haven't been kept informed of the reasons for the delay and when your father is likely to have his operation. Is that right?
Yes, that's about it. No one has bothered to tell my father anything. They've just left him here starving and waiting for an operation that might never happen. It's not right doing that to an old man. It does seem very harsh when you haven't had a drink all night and are probably very hungry.
I can help you out with that. After we've had our chat, Mr. Madison, you can rinse your mouth out with a small amount of water as long as you don't swallow any.
That sounds wonderful. Well, that's all very well and good, but what about the rest of the problems?
I know that the time for your operation was supposed to be 10 o'clock. I've just checked with theaters to find out the reason for the delay. Apparently, the patient who was first on the list before your father had a few difficulties after his operation. It has taken a bit of to stabilize his vomiting.
That's not Dad's fault. Why should he have to wait? And I don't know that these things has happened or not. You should know about these things and fix them.
I can understand your feeling that way. Unfortunately, this was the first anesthetic the patient has ever had before, so no one knew how he would react. The staff in recovery think that he should be all right soon. That means that your father will be able to go for his operation.
Sounds like a cover-up. I don't believe you all.
I know that it is hard when you have to wait so long, but it is very important that you have your operation.
Well, I'm not so sure. If it was so important, you'd have made sure he had the operation on time.
I agree that treatment schedules don't always go to plan, but it really is very important that your father stays in hospital. Would you be willing to wait a bit longer, before you make the decision to take your father home or not?
I don't know. Dad shouldn't wait around forever.
I understand what you were saying. If I keep you up to date with what's happening, would you be willing to wait a bit longer?
I guess so. As long as we know what's going on.
Yes. I'll make sure that I tell you how long your father will be waiting.
Thank you, nurse. I would appreciate that.
Thanks for understanding this.
You will now have 45 seconds to review your answers.
Part 1. Task 4. Patient injury. You will watch a dialogue between a nurse and a patient in a video scenario. You will get 45 seconds to read the questions.
Listen to the recording and select your answers.
Good afternoon. Myself Amelia. I am the community health nurse today. I come here to check your toes. Can I come in, please?
Yes, sure, thank.
You all right? Now tell me about how are you feeling today?
Oh, yes, I am doing good. I am feeling better than last days. My toes are also not bad these days.
All right, so have you followed the correct treatment routine all these days?
Yes, I have been following that all the way it has been advised to, and I believe that it is truly evident on my toes.
I am so glad to hear that you are following the treatment, which is very good for you. So, do you think that, after following correct routine practice, makes you feel better now?
Yes, I can see that my toes was having discoloration before and now it got changed. Also, I don't have any swelling too. I believe that my condition is improving day by day.
So please keep doing it till the day it has been prescribed and continue it regularly. Definitely your toes will be back to normal very soon, once after it's fully recovered. You need not to practice it again. You can stop the treatment regimen.
All right.
So let's move to some assessment. Have you noticed any abnormality on your toes?
Oh, sorry. What do you exactly mean by abnormality?
Oh, That means it is very important to notice whether you have any pain, discoloration, swelling, numbness, or discomfort on your toes. If you face any of these kind of problems, you should report us immediately.
Yes, as I said before, I am not feeling any discomfort, and I am more comfortable nowadays.
I understood, but sometimes there are risks to happen. So you should take care of these all things. That's the reason why I told you. In case if anything happens, you should let us know, so we can arrange necessary follow-up and checkup.
Oh, yeah, thank you for your concern.
Have you made your podiatrists regularly?
Yes, I think I have appointments 3 months later.
Oh, yes, now I remember. I am having an appointment in the next 3 weeks. So, I can arrange another home visit after you've finished with your podiatry review. What do you think?
Yeah, that's fine. Is it really needed?
Yes, it is really needed, because only after the podiatry review, I can know what exactly is needed for you, and that's why I prefer to arrange it after the review.
All right. I don't have any issues with that.
All right. I'd like to remind you again that you follow all the medications as per the doctor's advice. Do not miss or skip any set of medication until the doctor asks you to stop. Please let me know once you complete a review with doctor, so that I can fix the day for a home visit.
Oh, sure. Great.
Is there anything I can do for you?
Not really. Things are getting better. I am okay with it.
All right. Thank you. We will meet during the next home visit.
Thank you and have a good day.
You too. Thank you. You will now have 45 seconds to review your answers.
Part 2. Tasks 5 Instructions. Listen to the report and dialogue and circle the correct answers as you listen.
Task 5A, Shift-to-Shift Report. As you listen to the Shift-to-Shift Report, circle the best choice for each room and patient. You will get 45 seconds to read the questions on the chart before the audio begins.
Listen to the recording and select your answers.
This is the evening shift report for Thursday, November 2nd. Room 702. Mr. Jacob is recovering. His blood pressure was high yesterday, so the concerned doctor prescribed him to continue the medicine benazepril. He is very aggressive in nature. He won't be soothed by your extra attention and may become belligerent, demanding to know such things as, "Why isn't my treatment working?" or "Why aren't my medications ready yet?" Room 703, Mr. Ethan had an elective bilateral inguinal hernia repair this morning. His wound is covered and dry and his post-operative observations are stable. Temp is 37, his blood pressure 140/70. He's already started eating a little and his walking is tolerate. Analgesia is written up but he hasn't needed anything. He's planned for discharge tomorrow. His wife can pick him up. Now, room 718, Ms. Linda, she's been taking 50 mg tablets of diphenhydramine for allergy a week. Now the thing is, she says the tablets are making her feel really drowsy and her mouth's really dry ever since she started on the pills. So today we need to talk to the concerned doctor. Also room 726, Ms. Sarah, who came to the ICU last night after valve replacement surgery. Her blood pressure is normal. We checked the other equipment to make sure everything was working properly. So we're going to turn her, and check she doesn't have any pressure sores, and do some respiratory therapy to help expand her lungs, and teach her some breathing and coughing techniques. It's very important that the lungs are kept clear so infection doesn't build up there. She's currently on medication and we'll see how that goes. Okay, room 728, Mr. Miller, is a 56-year-old that came through the emergency department and admitted for pneumonia. He is presented to the emergency department early this morning with difficulty breathing, cough and chest pain. He had a room air oxygen saturation of 84. He has a history of a recently treated pneumonia and we are currently giving him IV antibiotics and IV steroids. Room 732, Ms. Anderson. She's a 60-year-old female who was admitted through emergency with chest pains today. She's abnormal ECG with a negative troponin so far and she's reporting a 5 pain that's down from 8 on admission. She's on a cardiac diet. She's aware that if she needs to go to the bathroom, she needs to press the call button, but she's a bit resistant to the idea, so you need to keep an eye on her. She's also got 2 milligrams of morphine available for pain as needed every 4 hours. Okay. Well, I think that's all to report. For now, hope you have a good night.
You will now have 45 seconds to review your answers.
Task 5B, Shift-to-Shift Report. Now, listen to the shift-to-shift report again, and circle the best choice for each room and patient. This time, you will need to listen for different details.
Listen to the recording and select your answers.
This is the evening shift report for Thursday, November 2nd. Room 702, Mr. Jacob, is recovering. His blood pressure was high yesterday. So the concerned doctor prescribed him to continue the medicine benazepril. He is very aggressive in nature. He won't be soothed by your extra attention and may become belligerent, demanding to know such things as, why isn't my treatment working? Or, why aren't my medications ready yet? Room 703, Mr. Ethan, had an elective bilateral inguinal hernia repair this morning. His wound is covered and dry and his post-operative observations are stable. Temp is 37, his blood pressure 140/70. He's already started eating a little and his walking is tolerate. Analgesia is written up but he hasn't needed anything. He's planned for discharge tomorrow. His wife can pick him up. Now, room 718, Ms. Linda, she's been taking 50 mg tablets of diphenhydramine for allergy a week. Now the thing is, she says the tablets are making her feel really drowsy and her mouth's really dry ever since she started on the pills. So today we need to talk to the concerned doctor. Also room 726, Ms. Sarah, who came to the ICU last night after valve replacement surgery. Her blood pressure is normal. We checked the other equipment to make sure everything was working properly. So we're going to turn her, and check she doesn't have any pressure sores, and do some respiratory therapy to help expand her lungs, and teach her some breathing and coughing techniques. It's very important that the lungs are kept clear so infection doesn't build up there. She's currently on medication and we'll see how that goes. Okay, room 728, Mr. Miller, is a 56-year-old that came through the emergency department and admitted for pneumonia. He is presented to the emergency department early this morning with difficulty breathing, cough and chest pain. He had a room air oxygen saturation of 84. He has a history of a recently treated pneumonia and we are currently giving him IV antibiotics and IV steroids. Room 732, Ms. Anderson. She's a 60-year-old female who was admitted through emergency with chest pains today. She's abnormal ECG with a negative troponin so far and she's reporting a 5 pain that's down from 8 on admission. She's on a cardiac diet. She's aware that if she needs to go to the bathroom, she needs to press the call button, but she's a bit resistant to the idea, so you need to keep an eye on her. She's also got 2 milligrams of morphine available for pain as needed every 4 hours. Okay. Well, I think that's all to report. For now, hope you have a good night.
You will now have 45 seconds to review your answers.